My name's Richard Matundura. I'm a program psychologist from IAM. I've been working in the community for the last 15 years, and my main job is to support people who are using alcohol and substance use to reduce and stop. So we have been having a training here at Linzzi School, and the main aim is to support people who are willing to go out in the community, work as recovery support groups, so that through the support groups, other people can be reached and be supported. So far, we have discovered the expense of taking people to the rehab. So many people do not afford. So this has been a strategy for us to reach so many groups. So far from where we have been, we have so many groups that are running and people are recovering. Apart from the recovery, we are also sensitizing people on mental health, like mental health as a disease and is need to be supported. The patients need to be supported. So this is what we have been doing in the community for all that period, and we hope that after this training, many people will be reaching Kilifi and there will be a change.
My name is Lolo. I'm a medical psychologist working with the AMPATH Afya Akili Mashinani program. And basically what we do in this particular program, which is part of one of our community projects, is we try to do what we call task shifting. You realize that the resources around appropriate intervention for mental health and substance use care is very limited.
Majina kamili najulikana kama Bwana Joseph Sindala, mkazi hapa Mtwapa. Ningependa sana kushukuru watu wa Keep Love, Westlax Keep Love Alive. Wametuunganisha na wa madaktari kutoka Eldoret kwa shirika la IAM ya afya akili mashinani. Hayo yote wametufunza hapa kwa hii wiki nzima. Imenifunza mambo mengi. Nimejua how to handle stress management. Nimejua mambo ya kuhandle watu wenye wanapitia changamoto ya ulevi na kutumia mihadarati. Mimi pia nikitoka hapa nitapeleka hii ujumbe mashinani kufunza wenzangu na kufikisha kwa group zingine, kwa wale wenye wana changamoto na hii janga la kutumia dawa za kulevya, mihadarati na pombe. Asanteni sana na Mungu awabariki.
My name is Patience Mwangeka. I'm a social worker, community worker. Again, I'm a secretary at PBO, Mombasa County. I was here learning about mental illness. One thing I've realized that mental illness and trauma healing ni kitu moja, hazijaachana mbali. Again, I've learned about withdrawal and cravings. At least now I know how to conquer my cravings and the urge. Nikitaka nini yenye nitafanya na kupunguza hasira. It was a very wonderful session from Monday. Today is on Friday. We have covered 17 sessions. I've learned, and again, apart from learning, I've made friends who love one another, and we pray for more empowerment sessions again.
nashukuru sana walimu, mmetupea knowledge. Kuna vitu tulikuwa tunapitia na tujui, kama hii depression tunapitia na tujui. You've made, yani we have really changed. Okay, mimi nimechange. Saa vingine nilikuwa naweza piga mtoto, yani nampiga. Kumbe sikuwa najua, but nimekaa kujua nilikuwa kuna kitu inanisumbua. Kwa hivyo I'm very grateful. Asanteni.
My name is John Kinyanjui, the President Keep Love Alive Kenya, and today I'm very happy. And what I would just like to shed light to you is that today we have just completed the 5-day lesson that we were learning here at Linzzi School, and it was all about mental illness. And to be honest, personally, I've learned a lot, and I really appreciate my fellow love ambassadors for accepting to come so that they can learn a lot about mental illness. And I also hope that what we've learned today, it is something that is going to be taken so seriously by the love ambassadors, and I'm sure outside there they are going to educate others about mental illness and also the disadvantages of using alcohol and drug abuse. Thank you so much. My name again is John Kinyanjui, President Keep Love Alive Kenya.